Hi, my name is Tiana James, and this is a staff training for the Culturally Responsive Assessment and Intervention Questionnaire, which I have right here, and we're going to go over how to fill this out today and the importance of it. So let's talk about the purpose of the Culturally Responsive Assessment and Intervention Questionnaire and its importance. So it allows for professionals to ensure that they are utilizing cultural responsiveness in the assessment and intervention processes. It can be used as a guide for incorporating cultural variables in the assessment and intervention processes if you're not sure how to. And it's important to ensure equitable service delivery in clinical practice. So we have our objectives here. So the first objective is to apply cultural responsiveness. So we don't just want to know the definition, we want to be able to use it in our clinical practice and professional activities. Next, determine cultural variables to include in the assessments and interventions. Then to determine culturally responsive assessment tools and interventions. Identify ways to learn more about a cultural background. Identify ways to effectively communicate to stakeholders of differing cultures, and then describe systemic barriers that may impede clients' assessment and intervention processes. So the first section of this questionnaire is the client profile and cultural considerations. So for the client profile, you're going to include the client's age, sex, spoken language or languages, their cultural background, so ethnicity, race, religion, and then family dynamics. So do they come from a single parent household or a two-parent household? How many siblings they have, total number of people. You're also going to include their socioeconomic status. So if the client is a child and they don't have any education or they don't have a job, you're just going to include the education of the caregivers and the occupation of the caregivers. So then we also want to know the concerns related to the client. So what was provided by the family or other professionals to where they were referred to ABA therapy. So then we have the cultural considerations. Here we want to include the cultural factors that may influence assessment and interventions, and also the cultural variables such as language, socioeconomic factors, family structure, and religious beliefs that are significant in the client's life. The next section of this questionnaire is culturally responsive assessment. So here we're going to include, we're going to talk about assessment tools. So what assessment tools could be used with this client to evaluate his or her skills and behaviors, and you're going to explain how these tools best suit the client. And then you're going to consider if the assessment tools that you have chosen are culturally appropriate. And if not, you can write how you would modify the assessment tools to be more culturally responsive. Then we have personal biases. So what personal biases, we want you to identify what personal biases that you may have. It could be implicit biases that you may not even know that you have, and what steps you can take to offset these personal biases. Also, communication with stakeholders. We want to know how you will communicate with them before and throughout the process to ensure that they are being included and their opinions are being valued and heard. Next, we have the culturally responsive intervention plan. So you're going to provide at least 2 evidence-based interventions that consider the client's cultural factors. If this is an intervention that you feel that you can modify, write how you can modify it. And then we want you to take into account cultural factors, how these may positively or negatively affect the client's treatment, and what steps you will take to reduce any negative effects that may occur. And again, we want to talk about communication with stakeholders. So how will you communicate with them throughout the process to ensure that interventions are culturally sensitive? Here we want to highlight considering the family's feedback and how you incorporate that. Next, we have applying the DEI principles. So how would you promote diversity, equity, inclusion, and also the client's autonomy? Also here, we're going to ask for you to identify any systemic barriers that you think could potentially impact this family and their treatment, and how you can limit these barriers. You also want to include here what resources you can provide the family to help them navigate these barriers. All right, so here we have the best practices. So first, you want to ensure that all questions are answered fully. Don't skip any questions unless they're not applicable. Once finished filling out the questionnaire, decide whether or not your assessments and interventions chosen are culturally responsive. So we want you to decide for yourself. And then after you do that, a good tip here is to provide the completed questionnaire to a mentor or supervisor and ask for feedback and have them tell you whether they think it's culturally responsive. In the event that it is determined that assessments and interventions are not culturally responsive, we want you to make any necessary adjustments. And if a question is unclear, you can refer to a sample questionnaire that I have provided for you. Here I have filled out all of these questions. So this will help you to fill out the questions if needed. So let's do the quiz. Question number 1, which of the following is not included in the client profile? Cultural background, socioeconomic status, family dynamics, food preferences, or spoken languages. All right, and our answer here is D, food preferences. Though these are important in a client's treatment, these are not necessarily related to cultural responsiveness. All right, second, if it is determined that assessments and interventions are not culturally responsive, you should. Give you a second to answer this. Make necessary adjustments. Yeah, you definitely don't want to just leave the assessment or intervention processes the same. Either adjust the assessment and intervention or find a completely new one that does take into account the cultural factors. All right, and our last question, true or false, it is not recommended to have the completed questionnaire reviewed by a mentor or supervisor. And our answer here is false. We do want to have the completed questionnaire reviewed by a mentor or supervisor because sometimes we're all guilty of it. We think of ourselves as always using cultural responsiveness, but it'll be good to have a second opinion there. All right, so our conclusion, this questionnaire can help professionals ensure cultural responsiveness in assessments and interventions. If cultural variables are not taken into account, the client may not receive quality care, affecting progress towards goals. When completing the questionnaire, all questions should be answered fully. You must make necessary adjustments to assessments and interventions if they are not deemed to incorporate cultural variables. And then lastly, I have included some sources for some further reading about cultural responsiveness, and this should help you understand cultural responsiveness if you don't. Thank you.